Wrestling is an intense and demanding sport, most commonly practiced at the high school, college, and Olympic level. Wrestlers can end up with some unique sports injuries. While most wrestling injuries include the typical strains and sprains, serious, traumatic, and unusual injuries can occur as well. Using proper safety gear and learning good technique can go a long way to reducing the risk of injuries during wrestling. The most serious wrestling injuries affect the shoulder, elbow, knee, and neck. Today, we look at knee injuries in wrestling. Data suggests that the most common cause of wrestling injuries is forcing a joint beyond its acceptable range of motion. During a wrestling match, competitors almost always end up in situations shown on the screen. Your knee is in the referee's hands at this point, and not all referees will stop the match to reset the wrestlers, especially when the match is close. This can cause great damage to the knee and can jeopardize one's career. We will be going over joints that are affected and how to prevent or treat these injuries in case they are to happen. The majority of knee injuries in wrestlers occur to the ligaments of the knee joint, more specifically the ACL, PCL, MCL, and LCL, or anterior and posterior cruciate ligaments and medial and lateral collateral ligaments. First will be the ACL and PCL injuries. Causes of the ACL injuries include partial or complete tears that can occur when an athlete changes direction rapidly, twists without moving the feet, slows down abruptly, or misses a landing from a jump. This type of movement may cause the ACL to stretch to the point of tearing. PCL injuries are likely with impacts to the front of the knee or from hyperextending the knee. The PCL can also be injured by a direct impact from the outside of a knee joint. The degree of injury may determine the type of treatment recommended. Incomplete ACL and PCL tears are treated conservatively to allow the body to heal on its own. RICE, or rest, ice, compression, and elevation, is the immediate treatment. Anti-inflammatory medications can also help reduce the pain, but physical therapy is often recommended to regain and build muscle strength over time. For a complete tear of the ACL, arthroscopic surgery and ACL reconstruction surgery is usually performed. Now we take a look at the MCL and LCL injuries. MCL injuries are most often caused by a blow to the outer side of the knee that stretches and tears the ligaments on the inner side of the knee. The classic sign of this injury is hearing a pop and feeling the knee buckle sideways. Pain and swelling are immediate. The LCL is most commonly torn during sports activities or traumatic injuries. The LCL is torn when the knee bends inwards excessively and the LCL is stretched too far. Minor sprains of the collateral ligaments will heal with rest and gradual return to activity. Rest, ice, compression, and elevation is also used here to help reduce the pain and swelling in the knee. A knee brace may be used to protect and stabilize the knee. A sprain may take anywhere from 2 to 4 weeks to heal, but a severely sprained or torn collateral ligament may occur along with a torn ACL, which usually requires an arthroscopic surgery or an ACL reconstruction. Wrestling requires a high degree of flexibility, strength, and proper technique to prevent injury. It's essential for athletes to have appropriate instruction and coaching and to always follow basic safety precautions. Here's some tips from top wrestling coaches and the National Athletic Trainers Association. Number 1. Train with a highly skilled and qualified coach who specializes in proper wrestling safety training. 2. Improve joint flexibility. Studies show that wrestlers with a high degree of flexibility suffer fewer injuries. 3. Avoid dangerous holds and slams. Coaches and referees need to strictly enforce rules to encourage safe wrestling technique and the proper use of safety gear and equipment. 4. Avoid dramatic weight loss and weight cutting strategies by maintaining good nutrition and hydration throughout the season. And finally, wear the appropriate knee pads during all wrestling practices, meets, and tournaments. A knee hitting the mat over and over again can cause swelling. Padded knee pads can help prevent that. Another type of knee pad, called a shooting sleeve, which has less padding and is designed to help knees slide across the mat and help prevent mat burns. This gear is helped to prevent major injuries from occurring. Therefore, we should encourage anyone involved in the sport to wear the proper gear. I hope this information helped better understand you to the knee injuries within the sport of wrestling. Thanks for watching.